Stuff. Come on, computer. All right, so today's lab again is gonna revolve around body pH, and we've talked about before the very narrow range that our body exists as far as pH is concerned, and as we go through today's lab, we're going to explain why that is such a narrow range. Not just hey, this is what happens when we get too acidic, or this is what happens when we get too basic, but I'll try to give you a little fundamental understanding as to why it's going to negatively influence our homeostatic equilibrium if we get out of that normal physiological range. But before we can get into any of that, we kind of have to do a little chemistry review. All right. Because this is the part that kind of tends to confuse most students right off the get-go, is understanding about pH. So we're going to do a little review of pH and what pH is and how pH is calculated and all that type of stuff, so that you have an understanding about pH before we start talking about how pH affects the body. When we talk about pH, what we're referencing is the concentration of hydrogen ions in body fluid. All right. Hydrogen ions in body fluid are going to, whether we have too many or too little, are going to have a negative influence on our body tissues, particularly if we have an increase in hydrogen ion concentration. Now, if we have insufficient hydrogen ion concentration, that can be equally as bad. When we have, and this is the way that the foundation to start with. High hydrogen ion concentration means the solution is acidic. Low hydrogen ion concentration means the solution is alkaline. All right. In chemistry, in physical science, we used to say acids and bases, right? Well, they've gotten away from saying base and gotten more into, saying alkaline instead. Okay. Alkaline means base. So when we talk about high concentration of hydrogen ions, that's a solution that we would consider to be acidic. And an acidic solution has a low pH, right? This is the part that students trip over, all right? High hydrogen ion concentration means pH number goes down, all right? Low hydrogen ion concentration means pH number goes up. And when we talk about an alkaline solution, as far as chemistry class was concerned, what we usually talked about then was having the hydroxyl group, the OH group, which really hydrogen ion H and the OH ion, or the OH group OH, that makes what? It makes H2O, right? We have an H and we have an OH, so we have H2O. And all we're doing when we're creating an alkaline or an acidic solution is we're dissociating water. We're breaking water into its two components. So when we have low number of hydrogen ions, we have an excess number of OH. All right. Does that make sense to everybody? All right. Now, acids get all of the bad press. Okay. But acids are, but an alkaline solution on the far end of the spectrum can be just as damaging to tissue as an acidic solution. A very alkaline solution would be something like bleach. Bleach has a pH of about 12.5, and there are alkaline solutions that have a pH higher than that. Well, what bleach can do to your tissues or to your skin. I mean, how damaging it is. So you can imagine that something that was even more alkaline than that could also cause burns. So that, we can have alkaline burns and we can have acidic burns. And what a burn is basically is a denaturation of proteins, right? We've talked about in ANP1 what a burn was and how burns were some energy form which caused proteins to denature. Well, one of the energy forms that we can have is chemical energy, and that's what we're seeing with acidic and alkaline solutions. So any deviation from neutral or from a pH in the sevens range is going to start to creep towards being detrimental for our tissues. So we don't want to be at the extremes. Now, for our body, being just slightly out of neutral is extreme, right? We can only exist outside of that normal physiological range minimally. If we get too far out of that normal physiological range, bad things start to happen, and they start to happen very, very quickly. So again, what we're measuring when we measure pH is the concentration of free hydrogen ions. If we have an increase in free hydrogen, the pH is low and the solution is acidic. If we have a decrease in hydrogen ion concentration, the pH is high and the fluid is alkaline or basic. All right, so does everybody understand and have that put in their memory banks? High pH, low hydrogen ions. Low pH, high hydrogen ions. We're good? All right. So what are we going to do to try to keep ourselves in this physiological range right here? Because again, if we get out of this physiological range, right, even by a half a point, okay, if we get out of this physiological range by 0.6 of a point, death is going to occur. Right, so that's how narrow we're talking here. If we take the midline of this as 7.4, if we go up to 8, you die. If we go down to 6.8, you die. So that's the narrow range that we're talking about as far as pH is concerned. I know you're like, it's 8 o'clock in the morning, Dr. B, and we're really talking about death and by acidosis. Yes, I mean that's how specific and that's how important the balance of pH is. Now, one of the reasons for this, and I didn't touch on this, but I'll bring it, is that enzymes in our body are mostly going to be proteins, and we know that most of the tissue in our body is also proteins. So we can have a negative effect on those things. Plus, hydrogen ions, okay, carry a plus charge. And so that plus charge can mess with the electrical balance that we have across membranes. All right, so keep all those things in mind kind of as we're talking about regulation of pH. So how can we fix a deviation from the normal range in our body when we need to make sure that we're in perfect balance? Well, we have buffer systems set up, and these buffer systems are always active. And basically, a buffer system is just our body's way of utilizing substances that we already have in the body to help to basically maintain hydrogen ion concentration. Now, the first buffer system that we have is a protein buffer system. And our protein buffer system is related to any protein. All right. I'm not going to get into protein, structure and all that kind of stuff, but all proteins have hydrogen ions attached to them. Lots of hydrogen ions attached to them. Okay. So we can use proteins and their abundance of hydrogen ions to actually add hydrogen ions to them or take them away from them, okay, in a temporary setting. That's one thing to remember, is that these buffer systems, they can only be used in small changes to pH, and they're only a temporary fix, all right? Buffer systems are just used to create that little bit of balance that we need throughout the course of the day. If we have a huge change in body pH, a buffer system's not going to be any good to us. So protein buffer systems. In a situation where we have an alkaline solution, meaning that our pH is starting to go up, we don't have enough hydrogen ions, what we can do is we can borrow a hydrogen ion from our carboxyl group. So any protein that has a carboxyl group attached to it, if we become too alkaline and we don't have enough hydrogen ions, we can temporarily release a hydrogen ion into a free solution, which will then bring the pH back down. Now, on the other side of that, if we have too much hydrogen ion and our body is starting to get a little bit on the acidic side, we can take some of those free hydrogen ions and we can bind them to our amino groups. And we can take this, instead of NH2, this will become NH3. Right? Again, a temporary solution, a temporary fix. So if we take away the hydrogen ion from the carboxyl group because we've gotten too alkaline, when we bring our pH back down, we'll add those hydrogen ions back on. Right? So it's just a temporary solution to balance out our body's pH. Okay, so this is something that's always going on because we constantly have a change in our body chemistry. And one of the reasons that we have a change in our body chemistry is because of water. The amount of water that we take in the day is constantly being absorbed, and that's constantly changing our concentration levels of different ions, right? If I have a solution that's 50% and I pour water into it, it's now going to be less than 50%. If I boil some of that water off, it's going to be greater than 50%. So we're constantly changing the concentration levels of different ions, including hydrogen ions. So our water balance is going to have an influence, obviously, on our body's pH. So we're going to use that information later to be able to positively make changes to body chemistry. Now, the next buffer system that we can use is one that you should be familiar with, and this is our carbonic acid bicarbonate buffer system. And this is related to carbon dioxide. You should remember this formula, this reaction here from the respiratory system, right? In the respiratory system, it just had added onto the front of this reaction H2O plus CO2, and then we would drive it towards carbonic acid, and then carbonic acid would dissociate into a hydrogen ion and bicarbonate. Well, we can also use this, though, as a means of buffering hydrogen ion concentration. If hydrogen ion concentration goes up, meaning we become too acidic, we're going to then bind those excess hydrogen ions to bicarbonate, and we're going to drive the reaction this way. So we will have carbonic acid in solution. That's if we become too acidic. Now, if we become too alkaline, pH goes up, we're then going to take any carbonic acid that we have in solution and we're going to dissociate it, and we're going to drive the reaction this way so that we end up with free hydrogen ions and bicarbonate in solution. So it's, again, the direction the arrow moves, the direction the reaction is going is based on whether a solution is acidic or whether it's basic. If it's an acidic solution, we're driving the reaction this way. If it's a basic or an alkaline solution, we're driving the reaction this way. Again, this is a temporary solution, but this is a solution that can happen very rapidly. This is immediate. This is constantly happening in our body. We're using protein buffer systems. Then if that's not working, we're using our carbonic acid bicarbonate buffer system. But we also have another buffer system that works in the same way that carbonic acid does, and that's our phosphate buffer system, which is going to be almost exactly like carbonic acid, except it's using phosphoric acid. So again, if we have an acidic solution, we're going to drive the reaction this way. We're going to take these hydrogen ions out of solution, and we're going to cause the reaction to be pushed to the left. If it's an alkaline solution, we're going to take this phosphoric acid and we're going to dissociate it, and we're going to drive the reaction to the right. So again, our body is in a constant state of buffering. Why? Because we're in a constant state of changing concentration levels because of water intake and water loss. I mean, look, I'm gonna go ruck in a little while. Okay, I'm gonna go hike 4 miles with like 50 pounds in a backpack on my back in a little while. Okay, I'm gonna come back. I'm gonna be drenched in sweat, even though it's nice and cool outside. I'm a big sweaty dude, and I'll be drenched in sweat. So I will have lost water. Well, what do you think that's going to do to my hydrogen ion concentration? It's going to make my hydrogen ion concentration go up because now I've decreased my water level. So my concentrations for everything are going to be higher. So my body is going to have to compensate, and it's going to have to use these buffer systems to compensate for my increased hydrogen ion level. I'm going to take some water in. I'm going to rehydrate when I get back. Well, guess what? Now I've compensated and I've decreased my hydrogen ion concentration. I take a bunch of water in, water gets absorbed in my stomach. Now, guess what? Now my hydrogen ion concentration is too low. Now I have to dissociate some of these things and bring my hydrogen ion concentration back up to get my pH where it should be. So again, this is how our body is going to adapt to changes that happen to us throughout the course of the day. Now, again, these are temporary fixes. Our permanent fixes are going to come through renal and respiratory compensation, right? Now, respiratory compensation. We talked, question.
Do all of the buffer systems happen simultaneously, or is it in that order that you described, where we would rather, like, let's say, break down carbonic acid rather than phosphate?
No, well, I mean, the carbonic acid is going to be more readily available, so it probably is used before the phosphate buffer system is, and the protein buffer system is going to be used kind of before that because of the abundance of proteins and the ease with which we could just, add this hydrogen or take this hydrogen off. So I don't want to say that it's, oh, well, this one works, and then when this one becomes overloaded, it goes to that. But we there is going to be, probably more activity at the protein level, a little less at the carbonic acid, and then a little less at the phosphate level. So just because of the availability of it. All right, so respiratory compensation. We talked about respiratory compensation, unbeknownst to you, when we talked about respiration. Our respiratory system is going to help to regulate body pH by the amount of carbon dioxide that we lose. We're going to get rid of carbon dioxide when we are in an acidic state. All right. Now, I'm not talking about, well, actually I am. This can happen one of two ways, right? We can either use the respiratory system to maintain our pH balance, or we can lose pH balance because of respiration. Does that make sense? If we become too acidic or we become too alkaline, we can compensate for that by changing our respiratory rate. But we can also create an acidic or an alkaline situation because of our respiratory rate. All right. Remember, when we exhale carbon dioxide, we're taking hydrogen ions out of solution, and as we get rid of that carbon dioxide. And if we don't breathe enough and we don't get carbon dioxide, then we have carbon dioxide still in solution, so hydrogen ion concentrations are going to be high. Remember, when there's lots of carbon dioxide in the blood is going to be acidic because of the way that we transport that carbon dioxide. If we have low carbon dioxide in the blood, then our blood is going to be more alkaline. So we can use this mechanism to help us control body pH. So if we have a situation where our body's pH becomes too basic, what's our respiratory rate going to do? Our respiratory rate's going to go up. Okay. If we become acidic, we need to get rid of excess carbon dioxide, which is going to help to raise the pH. Now, if we become too alkaline, we're going to slow our respiratory rate, which is going to help us to maintain carbon dioxide, which is going to make our blood then more acidic. So we can use respiration as a means of compensating for an acidic or an alkaline situation. But again, it can also create an alkaline or an acidic situation as well. Now, respiratory compensation is great, and it obviously works by getting rid of carbon dioxide, and that obviously changes our hydrogen ion concentration levels. But the ultimate way we want to balance pH is by using what? By using our urinary system, by physically getting rid of those hydrogen ions. Because really, by respiratory compensation, we're not really getting rid of the of the hydrogen ions. We're just binding them to something to take them out of solution. But with renal compensation, we're actually getting rid of the hydrogen ions in the urine. So this is the ultimate way that we want to balance pH. Now, the difference between respiratory compensation and renal compensation is the availability of it. How soon can it happen? Well, with respiratory compensation, that can happen within a few minutes. All right. I mean, look, protein buffers, that happens, like I said, that's going to happen immediately. That happens within a few seconds, immediately when we see pH changes. Respiratory compensation is going to take a little bit of time because we have to increase our respiratory rate, and we have to do what? We have to wait for the heart to pump the blood through the lungs to be able to take that carbon dioxide out of solution. So it takes a little bit longer to happen because of the need for circulating the blood to and from the lungs. But renal compensation is going to take even longer. Why? Well, now we've got to get the blood to the kidneys. We've got to filter it out through the glomerulus. Then we got to send all that filtrate through all them damn tubules that we talked about last week. And we've got to take stuff out and put stuff in and take stuff out and put stuff in. And so renal compensation is going to take longer than respiratory compensation, but it's a more effective means of balancing body pH. Why? Because we're physically getting rid of the hydrogen ions, or we're keeping the hydrogen ions depending on the situation. So again, how are we going to do this? Well, we're going to use the proximal convoluted tubule, and we're going to use the collecting ducts. And we're going to either increase secretion of hydrogen ion concentration or increase the absorption of bicarbonate. So what are those two things going to do? If I increase secretion of hydrogen ion concentration, then that's going to do what to the pH? It's going to make the pH go up. Increased secretion, I'm getting rid of the hydrogen ions, I'm putting them into the filtrate, that's going to make pH go up. The reabsorption of bicarbonate is also going to make the pH do what? Go up. So if I lose hydrogen, the pH goes up. If I pull bicarbonate back in, the pH goes up. Now, can we resorb hydrogen and secrete bicarbonate? We can, but that's typically done only in extreme circumstances. So typically what we're going to do is we're going to manage pH by either secreting hydrogen or resorbing bicarbonate. So if pH is high, if we're alkaline, are we going to secrete hydrogen ions? No, we're not going to, because pH is already high. If I secrete hydrogen ions, pH is just going to go up. Am I going to resorb bicarbonate if pH is high? No. Because if pH is high and I resorb bicarbonate, pH just goes up. Now, if pH is down, then yes, I want to lose that hydrogen and I want to resorb that bicarbonate. Because by losing the hydrogen, that's going to help pH go up. And by resorbing that bicarbonate, it's going to help pH go up. So to bring pH down, we're basically just going to turn everything off. We're not going to secrete, we're not going to resorb, because we've already got the bicarbonate in the filtrate because we lost it in the glomerulus and in the glomerular capsule. And we're also, though, not going to secrete any more hydrogen ions. Remember, the hydrogen ions are going to get secreted through the sodium and hydrogen antiporter. So as we're bringing sodium, as we're resorbing sodium back in, we would be secreting hydrogen back out. So again, this is the means by which we're going to balance the concentration of hydrogen ions and bicarbonate. And we do it, like I said, in this way. If we're too acidic, okay, meaning pH is low, we want to lose hydrogen and we want to resorb bicarb. If pH is too high, we don't want to lose hydrogen and we don't want to resorb bicarb. Now, again, if we become too alkaline, I mean, if we're extremely alkaline, then yes, then we can actually begin to resorb hydrogen and secrete bicarb, and that happens in the intercalated cells of the collecting tubules. So that collecting tubule, where we're finishing off the concentration gradients of the filtrate, if it's extremely alkaline, we can see this happen. But this is really what helps to balance the pH of our urine and the specific gravity and all that kind of stuff. How clear is our urine? How concentrated is our urine? Is the pH high or is the pH low? If I've got a urine sample that's very clear, then probably the pH is going to be pretty high. Okay, not high, but at least it's going to be neutral or slightly above. If I have a urine sample that's highly concentrated, if it's very yellow in color, well, it probably has a very high concentration of hydrogen ions because that person is dehydrated. If that person's dehydrated, you would expect them to be acidic. So, oftentimes you can look at a urine sample and you can tell whether something is going to be possibly a little on the acidic side or possibly a little on the alkaline side, just by the color of the urine sample. And that can be a good indicator as to what's going on in the person. Now, remember, the pH of the urine is always going to be less than the pH of a blood sample. So blood sample is the best thing to get you body pH, because the urine sample is just an expression of how the body is working. It doesn't tell you what the actual pH is in the body itself. The pH in the body could be actually normalized because the pH of the urine is acidic. Does that make sense? Because then we've gotten rid of those hydrogen ions. We've fixed the problem in the body. So, you know, a urine sample is a great non-invasive way of telling, you know, seeing what's going on, but a blood draw is a much better way of knowing what's going on. All right. So does everybody have a kind of an idea as to, you know, when the body is acidic, this happens. When the body is alkaline, this happens. As far as respiration goes, as far as the urinary system goes. We're gonna look at this chart in just a minute, and hopefully the chart will kind of really, you know, that'll be the thing that kind of irons everything out. And when you see it on this chart, and you can relate to, okay, well, concentration of carbon dioxide, concentration of bicarbonate, and then that'll kind of make the light bulb go off. But we're trying to lay the groundwork here first. All right, so what can happen if we get out of our normal pH range? Well, like we said, normal pH is about 7.4, just because that's kind of the middle between 7.35 and 7.45. Any deviation 0.6 in either direction can result in death. And here's why. If we get acidic, all right, if we drop from 7.35 to 7.3, okay, 5/100ths of a point, we can suppress nerve transmission and it can create disorientation. So if we become acidic, we can begin to start to see some effect on the nervous system. If we go from 7.35 to below 7, this can put us into a central nervous system depression and put you into a coma. Now let's talk about why, all right? If hydrogen ion concentration goes up, all right, what is that going to do to the polarity of the membranes of those cells? If hydrogen ion concentration goes up, all right, what's it going to do to the polarity of those membranes? It's going to make it greater, right? Because we're talking about in the extracellular fluid, not the cell. But if I have hydrogen ions, which carry a plus charge, and I increase the number of plus charges on the outside of the cell, that's creating a hyperpolarization of the cell. Resting membrane potential is -70, right? So that means inside is -7, is 70 less than outside. Well, what happens if I increase the hydrogen ions outside? That makes the resting membrane potential get larger. And if the resting membrane potential gets larger, we get further away from threshold. If we get further away from threshold, it takes what? It takes a greater stimulus to reach threshold and fire an action potential. So as we become acidic outside of the cells, it makes it harder for the nervous system to fire action potentials. That's nerve depression. That's suppression of nerve transmission. That's going to create a situation where nerves are not going to function and fire properly. Does that make sense? Plus, we said it affects what? An acidic solution, we said, was going to denature proteins. And one of the proteins we said it would denature would be enzymes. So it's going to have a negative effect then on enzymes too. So we find a lot of enzymes in the synaptic cleft. So it can destroy some of the enzymes that are related to the breakdown of certain neurotransmitters. So being acidic is going to have a negative effect on the nervous system because it's going to change the polarity at the resting membrane potential. Now, how does that work the other way? Well, if we become too alkaline, we get an overexcitation of the nervous system. Why do we get an overexcitation of the nervous system? Because we're decreasing the resting membrane potential. If I have less positives out here, now instead of my resting membrane potential being -70, maybe my resting membrane potential moves to -56. Well, if threshold is -55, now I only need one change in millivolts to fire an action potential. So I'm making it easier for the nervous system to fire off. Well, if the nervous system is firing off more easily, it may be firing off more easily and affecting the muscular system. I mean, nerves control muscles. So if I have an overexcited nervous system, that can cause muscle spasms. If it gets too great, it can cause muscle convulsions. Well, what's our body's most important skeletal muscle? The diaphragm. So what if I go into this excessive nerve function, and the excessive nerve function is controlling the diaphragm, and the diaphragm goes into a spasm and convulsion? Then you can't breathe. So severe alkalosis can result in death due to convulsions or spasms, or a lack of the diaphragm functioning. So you'll die by asphyxiation. So does it make sense now how hydrogen ion concentration is going to negatively affect the electrical balance in our body? That's one of the things. It's going to cause denaturation of proteins, but it's also having a negative effect on our electrical balance. That's why it's so important, and that's why we have so many systems set in place to make sure that we balance that hydrogen ion concentration. All right. Any questions on that? Now, people always want to bring this up because it's become so popular in the last couple of years, and they ask about alkaline water, okay, and high pH water and all that kind of stuff. You go to the store, you see, alkaline waters for, oh, get your body's chemistry right, drink alkaline water, all this kind of stuff. And they, Dr. B, is it good? Should I drink alkaline water? I think it's another gimmick. Okay. I think it's another gimmick. In fact, I think that it's probably not as healthy for you. I think it's not healthy for you at all, probably. Here's the reason why. When people say, "Oh, well, if I drink alkaline water, will that make me less acidic?" Not really, because what's in your stomach? Hydrochloric acid. So when you drink alkaline water, if you drink water that has a pH of 9 instead of drinking water that has a pH of 7 when that comes out of your tap, or 7.5, what do you think is going to happen to that water when it hits your stomach? It's immediately going to become acidic. You're not absorbing this alkaline water, because once it mixes in with the stomach acid, it's no longer alkaline. And what's it doing to your stomach's pH? If my body's used to drinking 7.5 and I give it 9, well, then that's decreasing the pH in my stomach. And we'll talk about this actually in just a few minutes. And so, that could actually create an imbalance. Now, if you're a person that suffers from acid reflux or things like that, can drinking that maybe curb it or something? Yeah, possibly could. But look, honestly, that stuff is expensive, and I don't think it has the health benefits that are advertised for it. So, if anybody out there is drinking alkaline water and you wanted to know if it was actually doing you any good, personal opinion, I don't spend. Look, I drink tap water. Okay, I don't even drink bottled water. I grew up drinking out of a hose on the side of the house. And if we didn't have a hose, I just turned the spigot on and stuck my mouth right on the spigot. So, I'm still alive. I'm here. I'm pretty healthy. So, I don't buy into all the gimmicky stuff like that. Just be smart. So, all right, let's take a look at this chart, because again, I think this chart is a very, very helpful tool, particularly when you go to do your bonus homework. But it also gives you, I think, a really good understanding about what's going on in the body. So what we have here are 4 different situations. All right, we have respiratory acidosis and respiratory alkalosis. We have metabolic acidosis and metabolic alkalosis. Now, we didn't talk about metabolic changes, okay? But basically, a metabolic change is anything that we're taking into our body, okay? Not breathing wise, but anything we're taking into our body that's creating a situation. Respiratory acidosis and respiratory alkalosis, we've kind of touched on a little bit before. So let's start with the respiratory, because we've done that already. So respiratory acidosis. So how would we see, or if a patient came in and Mrs. Jones presented to you, what would you be looking for to see if she was in a respiratory acidic state? Well, we would be looking for changes to respiration that would create acidity. right? This is not a we're not talking about compensation right here. These are causes. So the cause for respiratory acidosis, first of all, what would we see if a person was in respiratory acidosis? We would see carbon dioxide levels that were elevated. So if you did blood work on Mrs. Jones and she had an elevated PCO2, okay, PCO2 is your percent of carbon dioxide in the blood, just like PO2 is your your amount of oxygen you have in the blood. PCO2 is the same thing. If her PCO2 is higher than 45, we would consider that to be excessive for carbon dioxide in the blood. If she had too much carbon dioxide in the blood, that would make her blood acidic because that carbon dioxide is dissociating and we'd have a high number of hydrogen ions. So what would the cause? So she would present with a high hydrogen ion concentration, low body pH. So if you drove blood on her, her pH would be low, her PCO2 would be high. And you would say PCO2 is high, there must be some issue with respiration. Okay. There's an accumulation. She's building up CO2 in her blood. So what could cause that? Hypoventilation could cause that, right? She's not breathing enough. Well, why wouldn't she be breathing enough? Well, maybe she's not breathing enough because she has some type of brain injury, right? Maybe there's something wrong with her medulla oblongata, right? Or maybe she drug overdosed and it's suppressed her respiration rate. And the suppression of her respiration rate is causing a buildup of CO2 in the bloodstream. Or it could just be because of decreased gas exchange. Decreased gas exchange, how? Well, what if they have an asthma attack? What if they have emphysema? What if they have pneumonia? What if there's some limiting factor that's causing there to not be enough carbon dioxide taken out of the blood? Well, how does that work with asthma? Well, asthma causes bronchial constriction. If the bronchioles get smaller, I can't move air in and out of the lungs as much. That's going to decrease the amount of carbon dioxide that I can get rid of. Well, what about emphysema? Well, emphysema restricts your thoracic cavity and it prevents you from breathing as deep, and you end up with these much more shallow breaths, which means you're not getting rid of carbon dioxide as much. What about pneumonia? Well, lack of space, right? Pneumonia, the lungs fill up with infection, they fill up with fluid. We now have less surface area. We're now getting rid of less carbon dioxide. So all of those processes, all of those diseases could create a state of increased hydrogen ion concentration. When else, like we said, when else would we see an increase, a temporary increase in hydrogen ion concentration? Well, we'd see it during exercise, right? Because we would see what? We see carbon dioxide levels go up during exercise. Remember, that's why we breathe harder when we exercise, is to get rid of that carbon dioxide, because we're what? We're making ATP. So if we have increased ATP synthesis from our mitochondria, that's going to result in increased CO2, which increases our respiratory rate. So, you know, I watched this special a while back on free diving and stuff like that. And free diving are these insane people that basically, you know, dive to hundreds of feet with no, like, you know, apparatus. They have no breathing apparatus. They just hold their breath, put their fins on, and they dive in these blue holes and they dive hundreds of feet down. Well, they've had people die, obviously, from that. And now you can kind of see why they die from that. They black out. Why do they black out? Nervous suppression. Why is their nervous system suppressed? Because PCO2 levels go up because they're not breathing, they're not getting rid of it. And when they're not getting rid of it, it makes their body acidic and they lose consciousness. Okay. So now that kind of makes sense when you think about, oh, well, this is what happened to this individual. Why did it happen? That's how it happens. So what do we want to do for somebody that comes in that's respiratorily acidic? Well, we want to correct the cause for their ventilation issues. If they're asthmatic, we want to give them a bronchial dilator, you know, make sure that they can start breathing well. If they have pneumonia, we want to put them on some antibiotics. We want to clear up the infection, increase the surface area so they can have gas exchange more effectively. But we can also immediately change affect their acidity by treating them with IV bicarbonate. So we're going to give them some IV bicarb. That's going to naturally bring their pH levels back up, and then we fix the problem. All right. The IV bicarb isn't fixing the problem. The IV bicarb is treating the symptoms, but the fixing the problem is going to take care of their respiratory situation. Respiratory alkalosis. So if respiratory acidosis means we have too much carbon dioxide in the blood, then respiratory alkalosis means we don't have enough. So why would we not have enough carbon dioxide in the blood? Well, if hypoventilation creates an increase of carbon dioxide, then hyperventilation is going to be a loss of carbon dioxide. So why would we be hyperventilating? I don't know. Maybe you're stressed out because of Dr. B's final exam and you're breathing super fast and you're hyperventilating. Well, guess what? That's going to decrease your hydrogen ion concentration because now you're losing excess amounts of carbon dioxide that your body wants you to hang on to, and that's going to make you alkaline. What if I'm in Colorado? What if I'm at Monarch Pass, which is like 12,000 feet? I'm going to have an oxygen deficiency up there. Well, if I have an oxygen deficiency, then won't that create a carbon dioxide deficiency as well? Yeah, because oxygen is being used where? In the Krebs cycle. And that Krebs cycle is what creates the carbon dioxide waste that we are then exhaling. Well, guess what? You can't make carbon dioxide unless you have oxygen. Because if you don't have oxygen, then you're not running aerobic respiration. So a decrease in oxygen concentration is going to also possibly lead to carbon dioxide deficiency, which could put you in respiratory alkalosis. So if a person comes in and they're in respiratory alkalosis, what are you going to do? Well, first of all, we're going to give them oxygen, okay? Or we can have them breathe into a bag. You say, wait a minute, Dr. B, breathe into a bag? Really? I thought that was like a joke. I've seen people do that. No, breathe into a bag. Because when you breathe into a bag, you're exhaling carbon dioxide into the bag. And then when you breathe in, you're rebreathing the carbon dioxide. So instead of losing carbon dioxide to the atmosphere, you're helping maintain the carbon dioxide because the concentration in the bag is preventing you from losing any more carbon dioxide. Because remember, diffusion happens what? High concentration to low concentration. So if what I'm breathing into is already highly concentrated, it'll prevent me from losing any more carbon dioxide to the atmosphere, and that'll bring my carbon dioxide levels back up, and that'll correct my alkaline situation. All right, makes sense? Respiratory acidosis, respiratory alkalosis, what causes it, how we fix it, all right? Because those are things that, yeah, you could see questions, okay, surrounding that type of thing on possibly the third exam and the final. I could ask you clinical questions like that. And that's what this lab is really about. It's about, clinical information. What can we do with all of this stuff that we've learned about? All right. Metabolic acidosis and metabolic alkalosis. Now, this is a little bit different because metabolic alkalosis and acidosis can actually lead to respiratory changes, right? We talked about what respiratory changes can do to create the situation. Now we're going to talk about what metabolic changes can do to cause respiratory presentation or respiratory symptoms, all right? So let's start with metabolic acidosis. So with metabolic acidosis, again, we have increased hydrogen ion concentration and we have decreased pH. Now, the cause for decreasing pH metabolically means that we're going to either see an increase in the accumulation of hydrogen ions or a loss of bicarbonate ions. So when we draw blood on this person, we'll see an increase or a decrease in pH. But that decrease in pH is coupled with a decrease in bicarbonate. So we don't see any changes. We see an acidic solution, but we don't see any changes with PCO2. So we go, okay, well, they're acidic, but it's not because of respiratory because their PCO2 is 40. But we see their bicarbonate levels are low. So why would their bicarbonate levels be low? Well, maybe they're losing too much bicarb. Well, how do we lose too much bicarb? Well, maybe they're experiencing some type of intestinal distress. Okay, maybe they've ingested something that has created a situation which is causing them to have a increased loss of water in their stools. Well, what does that have to do with anything? Well, remember, formation of fecal matter is about the absorption of water. Okay, when we ingest water, when we ingest food, remember we're finishing off fecal matter in the large intestine. The purpose of the large intestine was primarily to absorb water to create the density associated with fecal matter. If you have a pathogen that you've ingested, whether it be protozoa, bacteria, whatever, how does your body want to get rid of it? The pathogen is in your digestive system. Okay, how is your body going to get rid of it? It's going to get it out. Well, how's it going to get it out? Well, it's going to get it out as rapidly as possible. So when you've ingested something, okay, some type of pathogen, your body's going to go, hey, wait a minute, this is not supposed to be here. We need to get rid of this. So I know we're supposed to absorb all this water right now, but you know what? Getting rid of this pathogen is more important than me absorbing the water from this fecal matter. So we're going to get rid of the water with it. And that's what creates a situation where a person has diarrhea. They have loose stools, they have watery stools. The body's choosing to not take the time to resorb the water because of the presence of this pathogen. So the body's just getting rid of everything. Well, what else are we resorbing in the large intestine? We're resorbing electrolytes. So that's where we would be finishing the resorption of bicarbonate as well. So if we're losing excess of water, we're losing the bicarbonate with it. So that would put us in an acidic situation. Plus, what are we doing? Well, if I'm losing water, I'm not resorbing the water, then that's doing what to my hydrogen ion concentration? It's making me dehydrated. And we just said a few minutes ago, if you're dehydrated, you're acidic. All right. So losing bicarb, losing this excess water, not absorbing that water, becoming dehydrated, that's going to put you in an acidic state. Now, how else can we be in a metabolically acidic state? Well, we could have a buildup of hydrogen ion concentration, and a buildup of hydrogen ion concentration just means that we have we have a buildup of too much acid. So, like lactic acidosis. Well, who would have lactic acidosis? Well, somebody that had exercised excessively. They went to CrossFit games and they burned up, did all of these anaerobic exercises, which caused lactic acid buildup in the muscles. Well, that could put you in a state where your body is in a metabolically acidic situation. All right. Ketoacidosis. Ketoacidosis we relate oftentimes with patients that are diabetic, right? Their body, is building up these ketone bodies instead of getting rid of those ketone bodies. We build up ketone bodies because of a lack of glucose, because our body is going to convert these fats to ketones that we can then use for fuel. So we end up in this ketotic situation, or it could be a person on the keto diet, and that could put their body into an acidic state. Or the excessive consumption of acidic compounds. All right, now what in the world could we be taking that would create our bodies to go into an acidic state? What about aspirin? Aspirin is acetylsalicylic acid. That's the compound name for aspirin. So let's say you have a patient that comes in to see you and they say, oh, I've got really bad arthritis. You draw blood work and you say, well, do you take anything? Well, I don't take anything. You know why they said they don't take anything? Because they don't consider aspirin anything, right? Because it's over the counter. And this is why, in other classes that you may have had me in, I harp on, ask them about everything, okay? Because over the counter counts as well. Oh, well, Mr. Smith, how many aspirin do you take a day? Oh, as many as I need. How many is that? Oh, about 12. Oh, so you take aspirin excessively. Oh, well, that could be creating your acidic state. So how might that person also present? What would possibly also be a symptom that a person with excessive, that takes excessive aspirin, what would possibly be a symptom that they might present with?
Lethargic? Would they be lethargic?
Well, they might be lethargic. I mean, something though that you can see. Mr. Smith comes in Mr. Smith, you haven't drawn any blood on him yet, so you don't really know that he's acidic. But one of the symptoms you might see with Mr. Smith is he might have an elevated respiratory rate, right? He might be breathing hard. Well, Mr. Smith, why are you breathing hard? I don't know. I breathe hard like this all the time. Well, why is Mr. Smith breathing hard? Well, because he's metabolically acidic. And so his body is trying to compensate through respiratory compensation to get rid of the carbon dioxide to help bring his blood hydrogen ion concentration back down. So if a person has, is dehydrated because of diarrhea, or if a person has a buildup of acid because of ketoacidosis or lactic acidosis, or some type of consumption, increased respiratory rate might be a symptom that they would be experiencing when they came into you, because their body is trying to breathe excessively to get rid of the extra carbon dioxide. Now, on the flip side of that, we have metabolic alkalosis. Now, metabolic alkalosis means what? High bicarb or low hydrogen ion. So why would we have a high bicarb, low hydrogen ion situation? Well, we could be losing too much hydrogen in the urine. Why would we be losing too much hydrogen ion in the urine? Excessive water loss. Well, what would create excessive water loss? Diuretic. Okay, well, what things that you can consume would be diuretics? Alcohol, caffeine. Both of those are going to increase your frequency of urination, and that frequency of urination can then cause you to lose too much hydrogen ions. Because remember, if we're losing excess amounts of water, our body wants to make sure that the water that we're losing is properly balanced as far as concentration goes. So we're going to lose excess amounts of hydrogen ions, which is going to make us alkaline. What about vomiting? Yeah, I mean, vomiting, that can definitely make us alkaline. Why? Well, when we vomit, what's coming up with whatever was in our stomach? Hydrochloric acid, right? And if we're losing that hydrochloric acid from the stomach, what does the stomach have to do? It has to make more hydrochloric acid. Well, if I'm making more hydrochloric acid, I'm making that from my body tissue. I'm taking hydrogen ions from my body tissue to create the hydrochloric acid. So by creating hydrochloric acid, because I've lost hydrochloric acid, you can actually make the body alkaline, because we're using hydrogen ions to balance the loss of hydrogen ions that we have in the stomach. Does that make sense? Now, how else can we negatively affect? What else would cause the increase of hydrogen loss to the stomach? What would cause an increase in hydrogen in acid production in the stomach? Well, what about ingestion of alkaline drugs like Tums or Rolaids? People that excessively take those antacids are creating a neutral situation in the stomach. What's that going to actually do to acid production? It's going to increase acid production. And if we increase acid production, what's going to do to our body tissues? It's going to make our body tissues then alkaline. So, patient comes in, patient is, maybe hypoventilating, maybe the respiratory rate isn't as high, right? Because in a metabolic alkalosis state, we wouldn't be breathing as much. So maybe the respiratory rate is really low or is significantly lower. Well, why is the respiratory rate low? Well, we draw blood work. We notice that their PCO2 levels are fine. So it's not anything that's being driven by the respiratory system, but their bicarbonate levels are high. Mr. Smith, do you use antacids? Oh yeah, terrible heartburn. How many do you eat a day? All of them, like the whole container. You can't take that. You're only supposed to take what's recommended. I know, but if that works, then more works better. This is what patients say. This is how patients think. All right. So how do we fix the problem? Well, with metabolic alkalosis, we fix the problem by fixing the cause. All right. What's causing the vomiting? Take them off of their Tums. Take them away from them. You can't take these anymore. All right. With metabolic acidosis, again, we can treat any kind of acidosis with IV bicarb. Notice with the alkalosis, you don't see us giving the patient any type of acid. Okay, we're not IV aciding them. Okay, that just doesn't happen. We can give them some IV bicarb because we can dilute that enough, and that's not going to completely swing their pH. But we don't like to put acids into patients, so we don't administer those. But with acidic situations, yes, IV bicarb is an immediate fix, and then obviously we want to treat the cause. Does this chart help a little bit? I think this chart's pretty good because it helps to see the relationship between them, and to see how how they relate to each other, and again how respiratory symptoms can kind of express themselves in relationship to alkalosis or metabolic conditions. All right. Any questions?